Well, it certainly feels like a tipping point if you ask the public. I think we've seen unprecedented interest in the election. Obviously Medicare certainly galvanised a few. I think the issue really is, just what can you expect out of the public system? Is it going to be affordable in the next decade? I mean, if you do have private health insurance, what are you going to get covered for? How are you going to deal with all the cost and quality issues? I think there's just quite a lot that people are worried about, and if there's one thing we know, health and education will always be top of mind for many, many families. Well, I think we all had a discussion today that it would be really great if the government could provide some of that leadership around the vision and what we actually want out of our health system. Like how do we get access, how do we deal with fairness and equity, how are we going to fund it, who pays in terms of the younger and older generations. So I think that's a role for government. Clearly everybody's going to have to then, put their shoulder to, playing their part. I think the second set of issues are very much around the fact that primary care is the bedrock of the system, and we really need a system where GPs are part of a wider primary care team, and they're able to look after people with chronic disease in a much better way than we currently do. And I think third is, the whole issue of health information. We're in a digital age. Consumers want to know what's going on a whole range of things. They want to know who to believe, so there's how do we give them information, how do we help them navigate around the system. I think health has only begun to tap what technology will make available. I think with most services in the world, consumers drive change. We've seen that in all sorts of ways, and obviously the internet gives consumers a lot more power. And when they can connect up, with Facebook and social media, they have even more power. They can topple governments. So the short answer is, you would think, based on what happens elsewhere, that consumers will understand that power, will be able to use it better, and will be enabled. And so yes, the consumers should have that power. I think it's interesting that health has held out so long. Well, I think just in the way that we personally would want to be empowered. Most of us want to understand, a situation. We go to doctors and other health providers for hopefully reassurance, but some understanding of what's going on. We want to kind of know what the choices are around treatment. We want to know whether there's any evidence. And at the end of the day, we want to know what the prognosis is, so that we can kind of make our choices and do what we need to do. I think that's a typical model. I think the other hardest thing that we really struggle with is a lot of perhaps our lifestyle issues because we make choices around behaviour. And as we know, it's really, really hard to change behaviour, and sometimes we need help with making those small steps to make things seem more doable. Well, I think what the private sector has is an ability to respond more quickly, and hopefully if it responds to consumers in a way that's fair. You've got all of that innovation, you've got all of that response to consumers wanting things and getting delivered to them. I think the challenge for the private sector is it needs to do that in a way where it makes the whole system stronger. It's easy, in the private sector to make a lot of money, or to do something which is entirely in your own self-interest. I think that's the struggle, because we value health as a human right, something that all citizens should have a reasonable access to. And so the private sector's got a role to play, but it's got to be balanced up with what's fair for a citizen in the kind of society we want to live in. I think governments need to obviously set direction and vision. I think there are probably two areas that I think are important for governments. One is just the funding incentives for people in the system, whether it's states or Medicare or private health insurance rebate. The way you set funding incentives can drive good behaviour, indifferent behaviour, other kinds of things which perhaps don't use resources widely. So I think governments do need to be mindful of the financial incentives in the system to make people do the right thing. And as I repeatedly say, we're in a digital age where ultimately health information belongs to consumers, and the government really has a responsibility to make sure that all the providers in the system enable the consumer to be able to do those things. We wouldn't get on a plane to go to Europe without a whole lot of systems working together for us to be able to do that. But it doesn't work like that in the healthcare system, and that's the kind of change we needed to make.